My name is Massa, and today I'm going to be performing perineal care on a male and a female client. Before you do anything, you want to make sure to check your doctor's orders to make sure that is okay with the client you're going to be doing today. You're going to first knock on your patient's door after you gather supplies, of course. Knock on your patient's door, introduce yourself. Hey, Ms. Smith, I'm Morgan. I'm your student nurse today. Provide privacy, perform hand hygiene. I'm just going to check can you state your name and date of birth? You want to check this on your patient's wristband, making sure that you have the right patient. So she stated the right name, date of birth that matches the wristband. I'm going to then put on the gloves.
All my supplies, and now we're going to verify with the patient.
As I raise the bed to a good working height, I'm going to also explain to my patient what we're going to be doing today.
Okay, let's verify your name.
Okay, Ms. Smith, we're going to be performing perineal care, which is washing your genital area. Is that okay? Is this a good time? And she states yes, it is a good time.
Alrighty, we're good. I'm going to go ahead and sanitize.
So once I have her raised, I am then going to get my water together. Also, I'm then going to ask her, I'm going to place a bath blanket over the top of her.
Alrighty, Mrs. Jones, we're going to go ahead and get started.
I'm going to ask her to hold the top of the blanket.
Okay, so I'm going to then fold the blanket down. There are times where
I'm going to ask my patient at the time to hold the bath blanket as I pull the covers down.
Because on the bed bath, when you get ready to do the bed bath, and you get to Peri care, you're going to have to say, at this point, I will do Peri care, but I will demonstrate it on another video. So, you understand what I'm saying? You will have to show the Peri care.
And when you get down to the end of the bed, you want to make sure to fan fold your patient's linens. At this time, now I'm going to raise the head of my patient's bed to Fowler's or semi-Fowler's position.
everything looks good now. Okay, Mrs. Jones, I'm going to go ahead and start cooking. We're going to walk down from one side. Changing my towel. New towel. New light. Wipe down the other side. Right down. Okay, now I'm going to put my towel. Get it wet with a little bit of solution. And then I'm just going to wipe down from the perineal to the anus. Get another towel.
So we're raising that to bed. Hold on. We'll get this over. There we go. And then once your patient is comfortable, you're going to ask your patient to be put in dorsal recumbent position.
Demonstrate that naked again because I think I got some steps in that. If y'all don't want to watch it again, my advice is going to be
I'm then going to
steps exactly like it is on that paper. Okay, or either let's watch it again because like I said, I want you to
At this time, I'm going to place a waterproof pad up underneath my patient or client if not possible. I mean, rat or towel if possible. I'm asking the patient to lift up her hips.
The male parts on the back side, on the Peri care.
First, I want to inspect the perineal area, looking for any obstruction of the skin or any problems that may cause for irritation or a wound, maybe. And if I find anything, I want to make sure to document that as well. So, I'm going to do the I'm going to I'm gonna dip in the water and get my soap. I'm then going to wash away from me down to the rectal area. Use a different part of my rag. Go down this way. And then I'm gonna use another part of my rag and go down through the middle.
I will do, at this step, I will do this point, but it will be shown in another video. Listen to me, I'm going to explain
And
the whole
then
thing.
I'm
In your
going
bed
to
back,
take this gel and I'm going to
at this point, I would complete Peri care, which I will
spray
show
it
in
and let
another
it run
video.
through the
Now, if you
labia.
say you're going to show it in another video, you got to
And
do
after
it.
that, I'm gonna let it. I'm gonna pat dry.
Talking about like in the Peri care video, we was just saying the male part. Not
You remember, I took it out and I did
After
the
that,
part.
I am then going to have my patient return back to a comfortable position.
No, I need to know that you know how to do both.
I'm gonna lower the head of my bed.
The male part over there and put it on the bed, and then you remember I went around it and I rubbed down, and y'all was saying that I was grabbing this growth.
Then I'm gonna explain to my patient that I'm gonna be turning them over to their left side to do their rectal area. So, Ms. Smith, we have finished the perineal area. Now we're gonna turn you over to clean your rectal area. So, on the count of 3, 1, 2, 3. So, at this time, I would lower the bed rail. That way I can get over there. So first, I'm going to inspect the skin like I did before in the other video, or in the other area, looking for any skin lesions, any cuts, any abnormalities that may cause friction rubs or anything to cause a pressure. So now I'm going to get my soap and water again. Use the mitt technique. You're going to start at the top of the butt, run down. Actually, I lied. You're going to go up, my bad. And then you're using another part of the rag up. At this time, I would rinse my rag again. That way you have a fresh start when you go up. So now you're going to start from the bottom and go up. You're probably going to have to do this twice, so you're going to need another section of the rag. And once you finish that, you're then going to put out the water, and then you want to pat your eye. Once that is done, I'm going to cover my patient back up. At this time, I would remove whatever I've had under them, place a new disposable waterproof pad up underneath them to give them a clean, fresh start. If my patient is on their menstrual period, I would then place a pad underneath them, whatever they may need, if there's any discharge. So, Ms. Smith, I'm going to roll back over. And then for a male, I would then, for a male, you would do the same start procedures, but you would want to, if they're circumcised, peel the foreskin back and peel the foreskin back, rub or clean the tip of the meatus in a circular motion, making sure not to go over the top or a part you've already went over. You then want to peel the foreskin back and go in a downward motion to clean making sure you use a different side of the rag every time in the same mitt position. And then you want to make sure to clean the scrotum area, making sure that you're very soft with this, not too hard. And then you're gonna pat dry everything and then do the rectal area. But then now you're going to throw your dirty linens away. This time I'm going to place my sheet back up. I'm going to place my bedroll back up. Once the sheet is up, I am then going to remove my bath blanket. You're going to throw this away, or throw it in the disposal, or dirty linens, my bad. Make sure your patient is back comfortable. I'm going to remove my gloves, perform hand hygiene, lower the bed to the lowest position. I'm going to ask Miss Smith if she needs anything. Miss Smith, do you need anything? We are done for the bathing of your perineal area. Is there anything else I can do for you? She states no. So you're going to lower the bed to the lowest position. Document whatever you found and what you did. You also want to make sure that when you leave the room to sanitize, take all your dirty linens, clean your bucket, take your dirty linens, dispose of them, and you're done after you document.